if you dive into it, it's irrefutable that estrogen protects our bodies in so many different ways. Our muscles and our muscle strength, our bones against osteoporosis, our metabolic health, meaning our ability to deal with our glucose levels and the insulin in our bodies, our brains, dementia, our joints, things like frozen shoulder. I could go on and on. Our eyes, our skin, our brains when it comes to mental health. So anxiety, depression, all of these things that come up as symptoms in perimenopausal and postmenopausal ages, more and more we're understanding it is attributed to a loss of estrogen. It just really isn't in question on how important it is to our health.
I'm Jessica Vallant. I'm a physical therapist, women's health expert, and Pilates teacher, and my goal is to help all women feel strong, safe, and secure in their bodies. In this podcast, I'll share expert advice, facts, amazing guests, stories, compassion, and hope to help you meet your body in all seasons of life.
Hi, and welcome back to Meet Your Body. I am really excited to have you here and to chat with you today in this really personal episode where I am talking to you about my experience personally and also my knowledge around HRT. So if you are listening to this, we have 2 amazing episodes that we've released leading up to this episode with 2 experts. And I highly recommend that you go listen to those. So I'm going to defer to those quite a bit here, okay? Because again, I'm going to tell you, this is my personal experience and what I have been through. You absolutely are going to need to talk to your doctor when it comes to making decisions that are right for you. As always, I want to give you knowledge. I'm going to be the guinea pig sometimes. I'm going to tell you my experience, and then I'm going to tell you some of the facts and the science related data that we have around these issues, and I'm going to bring in the experts for you. But ultimately, all of that is to teach you how to be an advocate for yourself, how to use your voice when it comes to making decisions that are right for you, and finding healthcare providers who will talk with you about that. So my experts from the previous 2 episodes, we had a family physician who specializes in menopause, and we talked to her around HRT, an amazing, amazing conversation with Dr. Noor. And then we had Dr. Eleonora Teplinsky on, and she works with breast cancer patients, gynecologic cancers, and breast cancer survivors. And we talked specifically around survivorship, including some HRT issues with that. So again, I'm going to defer to those episodes when it comes to experts and also talking to your own doctor. But I'm going to get back to my experience. Let me give you some context. I know many of you have followed me for many years. You know my history. But for those of you who haven't, I'm going to tell you some context. So I am 47 years old. I have been in perimenopause probably around 2 years. I did have a hysterectomy when I was 42 years old, 41, 42, somewhere around there, 41 years old, I think. And I had 1 ovary removed. So I was still cycling regularly. I had a regular period until my hysterectomy. And so I chose to keep 1 ovary. And I talk about that in my stories around hysterectomy. But the real reason I wanted to keep 1 was I did not want to wake up in menopause. My doctor actually recommended that he take both ovaries because I have severe endometriosis. He thought it would help my symptoms. I did my own research, knowing that 1, taking both ovaries doesn't necessarily get rid of my endometriosis symptoms, but also there is science and facts that tell us that women who go into menopause early are at higher risk for dementia, heart disease, cardiovascular disease, stroke, so many issues that I didn't want to put myself in that category. So I chose to keep 1 ovary. So I have kept cycling, meaning I release an ovary, I cycle. I don't have a period because I don't have a uterus. And so I don't track that every month necessarily, but I know from my symptoms and my own body that I was still cycling every other month, every few months. Then around the age of 44, 45, and I have episodes on this too, if you want to go back and listen, I started to feel symptoms that I attributed after a few months that hit me they were perimenopausal symptoms. So that's where I am. I am not postmenopausal. I am cycling today. I believe I have my endo symptoms. They are flared up, which tells me I am probably releasing an egg. So I am not postmenopausal, but I'm definitely perimenopausal. So 47 years old, perimenopausal. I have a history of endometriosis, and I am a breast cancer survivor. So in late 2023, I was diagnosed with DCIS, which is a certain type of breast cancer. I had a double mastectomy, and my lymph nodes were clear. And I have been in follow-up since then, but I did not have to be on tamoxifen or any kind of hormones or any medication afterwards. So with my situation and my doctors having a double mastectomy and then my lymph nodes being clear, I am just on follow-up. I did not need medication after that. I did not need chemotherapy or radiation. All right, so that is the context with where I have been. So I obviously have known about HRT. I mean, most of my life, being in medicine, being in healthcare for 25 years. Obviously, it's a topic I know about. Let me tell you, some of my history with it, though, is, and we talk about this in the previous episodes, it's really important to understand what happened in the early 2000s when everyone became very afraid of HRT, hormone replacement therapy. Something happened in the early 2000s called the Women's Health Initiative. And basically, the government kind of said, okay, we're going to fund this really, really huge study. I mean, I think there were 16,000 subjects. It was a really large study to try to learn about HRT in women. Well, what happened was they announced partway through the study that they were canceling it and stopping it because they decided that the results were showing that estrogen was leading to an increased diagnosis of breast cancer. That came out in the media, all right? And it exploded. And I remember this. I mean, I was a physical therapist already at that time. And I remember that coming out, and suddenly, and I bet a lot of you do too, suddenly HRT is dangerous. It's bad. No one's going to give you HRT at all. We can't even eat tofu, right? We can't do any of that. It's going to heighten our estrogen, which is going to cause breast cancer. That's been the narrative for a long time. But let me tell you the truth around that. And it's really important. You can go in and do your own research, listen to those previous episodes. But we know now that data was misinterpreted. All right. It wasn't a complete study. Many of the scientists on that study have come out and written papers saying this was wrong. That was not the message we wanted to get out there. Estrogen, in the way that the study was done, did not lead to increased breast cancer. And cardiovascular disease and stroke. So we know that now. And so if you say, oh my gosh, HRT is just having a moment, everyone's talking about it, it's basically because we are finally allowed to have this conversation around how important our hormones are as women. So that's one thing to understand, is I want to dispel some of that fear. If you go back to that study was done incorrectly and it wasn't even interpreted correctly. All right. So that's important to understand. Another thing is, as I said, this is individualized. It is about you. It's just to give you knowledge and give you information so that you can go to your doctor and ask the questions and advocate for yourself. Only you can decide if this is a conversation you want to have. Because I've talked to some women on the other side that say, I feel pressured to take HRT and I don't want to. That is your choice, 100%. All right. All of this is your choice ultimately. But again, that gives you context in my situation. So that's what I kind of understood about HRT. I knew that study, and I started maybe 18 months ago really diving into it as a part of the services I want to offer my clients because I'm in the women's health space. Obviously, that's what I do. I work with women, and these conversations were coming up, and I wanted to absolutely arm myself with the science and the data and the research and all of those. So I got an extra certificate. I dove into all the learning, all those things. And then I was put into this situation of becoming a breast cancer survivor. So probably 6 to 12 weeks after my surgery, I saw my oncologist, and we were talking about what was happening next, like what the next 5 years were going to look like for me, for follow-ups and all of that. And I was getting ready to leave, and I hadn't asked anything, but I think probably knowing my age, she said, oh, and by the way, when you're ready to have, or if you get ready to have the conversation around hormone replacement therapy, I am absolutely open to having that conversation with you. I don't want you to think that you are absolutely not a candidate. That is a conversation that we can have, and there are options available to you. So make sure that we come and have that conversation. And I remember leaving thinking, wow, I'm so glad she said that. It's not something I thought of at the time, but I probably will at some point. And I'm so glad she simply opened the door to me to allow me to talk to her about that in the future. But again, that wasn't even something that was remotely in my sights to start or to do. I mean, I was just trying to recover from a double mastectomy at that point, mentally and physically. Then, and again, I was continuing to do my own research. And I will tell you, we know, I mean, it is just not even in question how valuable estrogen is in our bodies. If you dive into it, it's irrefutable that estrogen protects our bodies in so many different ways. Our muscles and our muscle strength, our bones against osteoporosis, our metabolic health, meaning our ability to deal with our glucose levels and the insulin in our bodies, our brains, dementia, our joints, things like frozen shoulder. I mean, I could go on and on. Our eyes, our skin, our brains when it comes to mental health. So anxiety, depression, all of these things that come up as symptoms in perimenopausal and postmenopausal ages, more and more we're understanding it is attributed to a loss of estrogen. It just really isn't in question on how important it is to our health. For example, women, you probably know this, women are at less risk for cardiovascular disease up until the age of postmenopausal transition, right? We probably all know that men are at a high risk of cardiovascular disease. Women catch up to men and surpass men after that postmenopausal transition around the age of 60, 65. I'm just summarizing. We are more at risk of cardiovascular disease. Do you know why? Loss of estrogen. Like that is why. It's kind of that clear cut answer, cause and effect. It really is truly something we can't get past. Again, that doesn't mean HRT is right for you. I'm just telling you the facts that estrogen helps protect our bodies. Okay, so back to my story. I left my doctor, but I'm diving more and more into kind of that understanding of what estrogen does. Then about, I would say maybe a year ago, not quite even a year ago, and this is where I'm going to get into real vulnerable, honest conversations with you, okay? Because that's what we're here to do. We're not going to put things under the rug and pretend like they don't happen. I'm going to tell you the truth. I woke up one night in the middle of the night with horrible vaginal itching. I mean, horrible. I was like, I just got bit by a bug. It was so horrible. And I have had yeast infections in my past, and it was not that. That is not the kind of itching I'm talking about. It is actually, it was more, I don't know how to explain it, more outer, all right? Like a more outer itching, but definitely all down in there in that area. And I thought, well, that was crazy. I don't know what happened. I really was like, I probably got bit by a spider. I don't know. And for the next few weeks, it just did not get better. It actually proceeded to get worse. And like it ended up hurting a little bit. And I kept looking for a scratch. Like it felt like I had huge scratches. It just didn't feel like anything else I had been through before. And it was waking me up at night. And I was doing all the things. I mean, I was doing the special baths that you take, and I was soaking in water, and I was using coconut oil, and I was just doing all the things that I had done before to help with that kind of situation. And it just wasn't helping. And at the same time, it was summer, so nice weather, which means I was doing some of my trail runs that I love so much. And I noticed, I'm like, I don't think that's helping. And my pelvic floor was getting much weaker, meaning I was leaking urine during runs that I don't normally. Because again, part of my history is I had severe prolapse, and I had prolapse repair surgery with my hysterectomy. So I manage my pelvic floor, but I absolutely am able to do trail runs about once a week, maybe twice if I'm really healthy. And I do fine with it. but it was getting worse and I was leaking urine kind of no matter what I was doing. All right, so that's what was happening. And again, I don't know how my brain kind of ding, ding, ding thought of it, but it really kind of hit me. Oh my gosh, this could be that loss of estrogen. I hadn't learned about this yet, but this could be that loss of estrogen. Let me look it up. And lo and behold, absolutely one of the top symptoms women experience as we lose estrogen and as we lose that elasticity in our tissues and our tissues get more dry and brittle is we absolutely will get very dry, itchy skin, especially down in our vagina and the pelvic floor muscles. That part I knew being a physical therapist. The pelvic floor muscles lose elasticity and it is more likely to leak urine and those things that we know. So I, again, dove into the research and started to learn about vaginal estrogen. So let me tell you just about HRT really quick, okay, to back up. Hormone replacement therapy comes in many, many shapes and sizes. And my conversation with Dr. Noor really goes into this. But to give you a really quick summary, we're basically talking about estrogen, progesterone, and testosterone. Okay, those would be the three. All three of them plummet as we age and go down, and they go down kind of at like progesterone is a really, really linear kind of line where it goes down, down, down until it's low. Estrogen, actually, when we're in perimenopause, it goes down, but it kind of goes up, down, up, down, up, down. So it doesn't follow a really smooth down line. It goes down, no doubt, but it'll go a little bit up and then way down, a little bit up, way down. So that is some of why we have erratic symptoms in perimenopause, because the estrogen is just kind of up, down, all crazy town. Progesterone goes down to testosterone goes down. And so those are the three that we tend to look out for HRT. And then you have many, many different ways to get it into your body, okay? So you can take pills. There are creams. There are patches. There are troches, so something that you would put in your mouth and like let dissolve under your tongue. For testosterone, there are pellets that they can even make an incision and put them into your body, and it's slow release over a few months. So there's many different delivery systems. Most of those delivery systems are systemic, meaning you take it into your body, cream, patch, pill, whatever it is, you take it into your body. It is processed through the liver and it is dispersed throughout your entire body. It's systemic. Vaginal estrogen can be delivered in a couple different ways, but it is local, all right? It's not systemic, it's local. It is, let's say it's a cream. Their cream is a really popular one to use. A cream that you put on in that area, it's vaginal estrogen. So you put this estrogen cream on your vagina and it is local. It is not absorbed into the entire body. It's not put through your liver. All right. So that's what makes it a little different. So I was looking into that, knowing from the research that vaginal estrogen is safe for breast cancer survivors. I'm telling you what the research tells us. I can tell you that if you go to breastcancer.org, they are absolutely saying that vaginal estrogen is safe for breast cancer survivors, and in studies even shows that it can increase the lifespan of breast cancer survivors. ACOG, the American College of Obstetrics and Gynecology, they recommend vaginal estrogen, that it is safe for breast cancer survivors. All of the big groups are telling us this. So I felt really safe with that, with my own research, what my learning had shown me, what all these organizations had said. And I started thinking, vaginal estrogen might be a really good way to go. I can reach out to my oncologist, but I kind of, again, felt really comfortable with the information that I was getting. So I went to a place called alloy.com, all right, ALLOY.com. And there's two big ones right now, Alloy and then MIDI also, MIDI. I'll put the links below in the show notes. And there are these amazing resources for women where they have doctors from around the country on staff. And when they find out your location, they are going to hook you up with one of the doctors to review your health history and your needs. And they can recommend a product from their website and send it to you in the mail. All right. And this is a very well respected online medical resource for women. And so I went in and talked to someone, said, this is my health history. I'm a breast cancer survivor. These are my symptoms. And so I got on vaginal estrogen. And for me, it was a cream, and it had an insert. Okay, so I put it in the insert, I put it up my vagina a certain amount every other day. That was the amount that was told, that was recommended for me. And so I started that. And within 6 weeks, all my symptoms were gone. All of them. My pelvic floor was stronger, itchiness, dryness. It was no doubt in my mind that was solving that problem for me. I will tell you, though, a little bit of extra for me. I don't think this is going to happen to many of you, but I tend to be in the 1%. So again, like I said, I have severe endometriosis. I was diagnosed when I was 25 years old. Endometriosis is an estrogen dependent, estrogen dominant condition. And so I found I was using the insert and doing all the things, and probably a couple weeks in, I had an endo flare. And I thought, well, that's funny. This is kind of coming out of nowhere. I've been okay for a while. I don't think I'm ovulating, but I mean, that's what happens with endo. Didn't think much of it. Happened again 10 days later. Suddenly I thought, the only thing different I'm doing is this estrogen cream. So that too, I dove into online looking, trying to find someone who talked about the research. There were a couple things that said, even though it's not systemic, right? By using the insert and putting that cream pretty deep up into my vagina, near where my cervix would be, it could be aggravating my endometriosis. So I tried it one more time. I was just cause and effect on myself. And I had it the night before, because you use the cream at night before going to bed. And the next morning, endo flare for 2 days. And I'm like, I think that's it. So I use it now as a cream topically on the outside. I don't use the insert to put it up my vagina. I just rub it on the outside, and that has solved all the problems with my endometriosis. And I follow the diagnosis, I follow the amount and the way to use from the doctors that I spoke with. And I will swear by it. And I'm going to tell you one other thing. And again, I'm not telling you to go do this, okay? I'm not telling you to go do this. I am telling you the power of estrogen. Around this time, some of you may remember, my psoriasis was flaring up on my face. Again, I had no doubt it was around perimenopause and the estrogen going down, because it was happening the same time that I was having that dryness and itchiness and burning. And then I also got a rash, which I was calling perioral dermatitis, that I was having a hard time managing. And I had changed everything, and it had gotten better, but it was still there. And like for months and months, I had done all of it, changed my soap, minimum makeup, all the things. So I decided I was going to use a little bit of the estrogen cream on my face. Again, it's topical. I wasn't worried about it. I saw a few experts talking about it, and now there's actually estrogen face creams out there. So I was like, I'm going to try this. You guys, it solved my problem. Solved my skin problem. I kid you not. Don't listen to me. I'm not telling you to go out and doing it. I'm telling you truly my personal experience, that I will never discount the power of estrogen. So I have been on vaginal estrogen cream since then, and I will be on it as long as my doctor says it's okay and lets me, and as long as it continues to help. And something fascinating about vaginal estrogen, all right, just a few months ago, we started talking, and there was some research and things that came out around genitourinary syndrome of menopause, which is exactly what I'm talking about. Dryness, itchiness, pain with sex, okay? So as it continues, it can decrease lubrication. You can have pain with sex. You can also start to have frequent UTIs. So those symptoms I mentioned, I hadn't been at yet, but I have no doubt as I age, definitely could have come. I just had the dryness, itchiness, like painful burning, kind of, like I said, like I had scratched myself really badly. But UTIs, pain with sex, loss of lubrication, all of that can come with this syndrome of menopause I just mentioned. And vaginal estrogen cream is being now universally recommended to help with that. And is being said that it will absolutely save thousands of lives. And I'm going to have more resources and links in the show notes below so you can learn more about this and how important it is, because UTIs are a very common thing for especially older women. And we are now talking about older women who are losing independence in nursing homes. And many times it is a cascade effect from a UTI to ultimate death for women at that age. And vaginal estrogen can absolutely make a difference with that and even ultimately save lives when it comes to that situation. So I will shout vaginal estrogen from the rooftops because, again, not only am I saying it worked for me, I am telling you I am confident saying that from the data and the research and the facts that we have now. So that is something that you could always go talk to your doctor about. It's kind of, I almost think of it as this like first open door. You know, if you want to dip your toes into a little bit of HRT and just see, like, feel really safe with it. If you do have some of those concerns around it, I absolutely understand. And if you want to dip your toes in it, I can't even explain the quality of life it has helped me with. Is it the magic bullet that's all I need? Absolutely not. I have also worked my buns off for the past couple of years on trying to sleep, get better sleep, working on my nervous system, stress relief, nourishing my system, lifting really heavy weights for my bones. I mean, all of those things. But adding that vaginal estrogen piece, I kid you not, has been so valuable to me. So that's where I am, which led me to also wanting to know more. Like, what else can I use? This is amazing. What else can I use? What else can I try? Being a breast cancer survivor, I will tell you that is a discussion I'm going to have with my oncologist. So I see my oncologist in a few months, and I will have that conversation with her then. I don't know where that leads me, because I will say, being on Alloy and having the conversation with that doctor there, they're not comfortable prescribing anything else for me because of my health history. Which I understand, and also is a bummer. If you have a health history that's complicated, it's a bummer when you feel like you're left out of conversations because of that. Again, also, I'm thankful for what I have, and I see my oncologist for my next follow-up in a couple months, and that's a conversation I'm going to have with her. It's just, what does my situation look like? What are the possibilities? You know, what's another doctor I should talk to to work with my oncologist, because this needs to be a team approach, and that's where I'll go from there. But I wanted to give you my experience. I wanted to give you some facts around it. And I just want to encourage you to listen to your body. What symptoms are limiting you? Like, how do you feel a limit of your quality of life? You absolutely can continue to have a high quality of life. That's what we want. And that leads to better health ultimately too. So ask the questions you need to. Take the research and the data to your doctors. If a doctor's not willing to have this conversation with you, find someone who is. Doesn't mean you need someone who automatically says yes, but you need someone who is up to date on the current research and is willing to listen to you and your quality of life. So I'll have, again, all of those resources for you below. Thank you so much for being here and listening to my story, and I will talk to you soon.
Thanks so much for listening today. I would love it if you could take a moment to subscribe, rate, and review this podcast. It means a lot to us, and it helps our content get out to more women who need it. You can find more of my resources at my website, jessicavallant.com, or find me on YouTube at Jessica Vallant and Instagram at Jessica S. Vallant.